Hi, Dr. Wallach. Thank you for taking my call. May God always bless you and your family.
Well, thank you. It's very kind.
I feel very privileged and blessed to have this opportunity to speak with you.
Okay.
I'm 37 years old. I weigh 300 pounds. I have always battled with a hormonal imbalance since I started my period around the age of 13. I've had irregular cycles, and when I'd go to the doctor about it, they'd say maybe when I turned 16, I'd have a regular cycle.
Mm-hmm.
But that wasn't the case. When I was 18, I went back still with the same problem, and they suggested birth control pills. I didn't take them.
Have you had children?
No, I haven't.
Okay, let's see. Did you say you're 200 pounds or 300 pounds?
300 pounds.
And how tall are you?
I'm 5'5".
Okay. All right. Do you have any other issues, any high blood pressure, diabetes, arthritis?
No, I don't have diabetes. I did, I went back to the doctor recently because before my cycles were irregular, I wasn't getting them. Now I went back because I'm getting them too frequently, very often, and they found that I have a tumor in my uterus and recommended that I had a hysterectomy, a full hysterectomy, to get rid of my uterus.
Okay, now, is this a fibroid tumor or is it a malignancy?
Well, they weren't able to tell me because they said only once they take out the tumor, they'll know if it's malignant. Mm-hmm. But they said that when they did find, after the exam that they did find some white blood cells and some cancer cells.
Mm-hmm. Okay. All right. So let's hold on here for a minute. Shar, are you there?
I'm here.
Okay, here's our friend Mary. She's 5'5", and is that correct? 5'5"? Yep. And it weighs 300 pounds. She's had PMS, problems most of her life, hormonal imbalances and so forth, plus the weight challenge. And what would you do for her? She got tumors now, so we have to be careful what we suggest. And so what would you do to suggest to support her immune system so that I'd stay away from the hormone thing right now, okay, because we don't know what type of tumor it is, because hormone supplements can drive cancer, so we want to stay away from the hormone supplements. But what would you give her to support her immune system? Because when you have cancer of any type, I would definitely, your immune system is your best friend.
Right. Well, for I know things with her weight and everything, one of the reasons she's got the weight problem is because she needs to get on a gluten-free diet because that's contributing to the weight problem. Mm-hmm. And for her issues, she really needs 3 healthy brain and heart packs. And then I would also suggest she takes the Xerafem and the Women's FX, and also the Fucoid Z for to build her immune system up.
Yeah, well, I'm going to stay away from the Xerafem and the Women's FX because those are hormone pushing things. And so, but I do like the Z Radical. Okay, 2. I'd go with a minimum of 2, optimally 3 healthy brain and heart packs a month. It's going to give her the nutrients she needs to support her immune system and provide for all the normal physiology. Also, the Z Radical, she could have 3 ounces a day. That's 3 quarts a month. Great antioxidants. She could have an ounce at breakfast, ounce at lunch, ounce at dinner time. And then, what would you do to help her with the weight loss?
Obviously, the Rev.
Rev, yes. And so she needs to go on 2 bottles of Rev per month. Put a dropper full under her tongue 30 minutes for each meal. Let it absorb through her oral tissues, and then put a second dropper full under her tongue 15 minutes for each meal. Let it absorb through her oral tissue. That'll be 2 bottles a month to pull that off. And she should start to lose a half a pound, 2 pounds a day. And when you get your decision what you're going to do here about the surgery or no surgery, that's up to you. We can't give you any advice for that. But whatever you decide, if they want to do a biopsy or if they just want to take your uterus out, whatever they want to do, and when they make a diagnosis of this lump or mass or tumor, whatever is going on inside the uterus, then give us a call again so we can actually be more specific on that piece. But let's go this direction and keep us informed. And once they've done what they've done and they make a specific diagnosis, we'll be able to help you a little more specifically, but this is a great start.